So there are different stages of diseases described in Ayurveda, and it's interesting to think how these could supplement and enhance the approach of modern medicine. Modern medicine is quite physical and very much to do with the structure. Ayurveda is holistic. It recognizes the structure, but that is one aspect. It's more the kapha aspect. The pitta aspect is much more the dynamics, the transformation, the chemistry, the biochemistry, the interactions that go on within the structure, which inevitably will result in the structure. But more than that, Ayurveda gets very sublime and understands what moves things, what actually moves the chemicals that will interact, what moves the various processes and the structures in the body. And it's often found that medicine has great difficulty in diagnosing conditions Ayurveda sees as vata, whether it be an anxiety or a panic. You can't x-ray it. You may find a structural correlation of an imbalanced vata. For example, a palpitation could be understood to be due to a structural abnormality in the conduction of material of the heart. But often, without that structural connection, medicine is challenged, and patients are left with a lack of insight into why they have irritable bowel, what is the cause, why do they have painful periods, ladies? Because vata, you cannot picture it. Now, this is one aspect that Ayurveda has to offer, but another is the sequence of development of the disorders, where the vata or the pitta or the kapha starts to go out of balance, and there's very little to be seen or known, except subjectively. There may be a slight discomfort for the patient. The second stage is where the dosha of vata, pitta, kapha gets aggravated. So this is a more extreme version of accumulation, if you like, with more accompanying discomforts, but still quite mild, and yet a person feels not totally right. The third stage of development is that now the aggravated doshas start to spread in the body, and so the general spread may subjectively be associated with increased discomfort. It could be aches and pains or stiffness or something, but still a visit to the doctor will not achieve anything in terms of an understanding or a diagnosis, because there's nothing to be seen. There's no disease that can be diagnosed. So the doctor will say, you're fine, but it doesn't help because you don't feel it. And then it progresses to a fourth stage where the doshas that are moving around the body find a vulnerable spot, a location of distortion already somewhere in the mind-body system, and the doshas then accumulate there. And still there's nothing medically, though there may still be a little bit more subjective discomfort. Now, the fifth stage from an Ayurveda perspective is when the disease actually manifests. So the accumulated doshas in that location suddenly flare a condition, whether it's a ruptured ulcer or whether it's an ulcer itself, or whether it's an arthritic joint, whatever. But now the doctor can see it, can diagnose it, and start a process of treating the disease, what he has noticed. The final stage of the progression of the disease in Ayurveda, the sixth stage, will be complications, which is where that ulcer would have ruptured, or where the arthritic joint would have become deformed. So these are the 6 stages of diseases in Ayurveda, and the reality is that the diagnosis at stage 5 or 6 is very, very late and makes it much more difficult to sort the problem out and takes a lot more treatment. And anyway, the treatments that medicine offers are not with an insight to the unfolding imbalance over time and how the disease developed. But Ayurveda is relating all of the disease symptomatology and even its prodromal symptoms before the disease manifests and understands how you're doing it. What is the lifestyle or the diet or the recreations even, or the experiences in your life that are contributing to and causing an accumulation of the imbalance. And that explanation and that understanding has given you then the insight to know what it is that you must do. Because even if you have to take the medicines, well, it's essential that you do the healing, because doctors treat, but patients heal. So your responsibility of healing is to recognize and understand how it all developed, what were the contributing factors, how do you start to reverse those processes, to undo some of the damage, and actually to heal. And that's why this insight within Ayurveda, that it allows you and empowers you, is so essential and valuable. Even if you are going the medical route, use Ayurveda as well. But preferably use Ayurveda to prevent you having to go the medical route by getting in early and sorting out. And this is the beauty. Not just prevention, but also health promotion. And the motivation there is the healthier you are, the more joyful you become, more fulfilled you become. And so that ultimately is where we ought to be going. But when we've lost sight of that, it could be the discomforts in our body that become the motivation. And they mount up as the disease progresses in the body until the manifestation. And if you have a sore joint, you become very motivated. But you become desperate. What should I do? What can I do? And taking the tablets, yes, but that doesn't inform you what you should do. And that's where Ayurveda, the knowledge of life, can be so useful for you.